What do you think the future of MCH is, and what the next set of issues are that we need to deal with?
Well, I think it's huge. If that hadn't passed 5 years ago, just looking at these issues we've talked about in healthcare practice, just in OBGYN, I said things were, in the practice community, were worse than I'd ever seen them in 40 years.
Really?
It was really bad. Very money-driven, a lot of crummy patient care, people ripping off the Medicaid and Medicare systems and going to jail or running to another country. Doctors have dropped in esteem from the top down to the bottom. They're just above politicians. And but I think there's just a lot of hope now. I think I was president of the Association of State and Territorial Health Officers when the Clintons were trying to get health reform going, and they involved us a lot. We went to a lot of meetings with Ira Magaziner and other misdirected people that were very brilliant but not so smart. Public health, by the time they had spent a year or so working on it, was just out of it. You couldn't even find it. And we'd complain, and they'd say, oh, we have a public health nurse working in a room right down there. But the prevention wasn't in that. Mm-hmm. So it was a good thing it failed. I think it was way overblown. But I think there's a lot more public health built into, and prevention built into what's coming. And I think it's really exciting. I just wish I was 30 years younger. The the opportunity for prevention is going to be huge. I think if I was in health policy and management now, I'd just be salivating, because the only way we're going to be able to pull it off is for HPM specialists to show how much money we're wasting, where the graft and corruption is, and getting these bad practices under control. So, and I just, on NPR coming in here, I heard about they're clamping down on hospital readmissions. You now get penalized if you have too many hospital readmissions. This is a boon for the pharmacy industry, for the pharmacists. And Walgreens is jumping in to this whole thing about, you send those patients to us right when you send them home. We will sort out their meds and make sure they understand these new meds they're on for heart failure or whatever. And that's a great place for Walgreens to hire health educators.
No kidding.
They're already hiring nurse practitioners. Walmart, Walgreens, all these places could have health educators in there, and the hospitals could help pay for them to prevent readmissions. Because a lot of readmissions are medication errors or things along that line. So you can look all over the landscape and see huge opportunities for public health.